Hello and welcome. Today, we'll be exploring a complex and often overlooked heart condition, Chagas cardiomyopathy. This is a serious manifestation of Chagas disease, and understanding it is crucial for prevention, early detection, and effective management. Chagas cardiomyopathy is caused by the parasite Trypanosoma cruzi. This parasite is typically transmitted to humans through the bite of infected triatomine bugs, also known as kissing bugs. These bugs often live in cracks and crevices of poorly constructed homes, particularly in rural areas of Latin America. When they bite, they defecate, and the parasite enters the body when the person scratches the bite wound, or the parasite enters through mucous membranes. Transmission can also occur through blood transfusions, organ transplantation, congenital transmission from mother to child, or ingestion of contaminated food or drinks. Once inside the body, Trypanosoma cruzi parasites invade various tissues, including the heart muscle. In the acute phase of Chagas disease, the parasite multiplies rapidly. Over time, in a significant proportion of infected individuals, the parasite persists in the heart, leading to chronic inflammation and damage. This chronic inflammation causes fibrosis, or scarring, of the heart muscle, disrupts the heart's electrical system, and weakens its ability to pump blood effectively. This results in cardiomyopathy, a disease of the heart muscle, specifically Chagas cardiomyopathy. Chagas disease, and consequently Chagas cardiomyopathy, is primarily prevalent in Latin America, particularly in rural, impoverished areas. It's estimated that millions are infected worldwide, with many unaware of their condition. Migration from endemic regions has led to increasing cases in non-endemic countries, including the United States, Canada, Europe, and Australia. This poses a significant public health challenge, requiring increased awareness and screening efforts. The signs and symptoms of Chagas cardiomyopathy can be highly variable and often develop years, even decades, after the initial infection. Some individuals may remain asymptomatic for life. However, others may experience a range of cardiovascular problems, including heart failure, characterized by shortness of breath, fatigue, and swelling in the legs and ankles. Arrhythmias, or irregular heartbeats, are common and can lead to palpitations, dizziness, and even sudden cardiac death. Chest pain, caused by angina, can also occur, along with thromboembolic events such as stroke due to blood clot formation. Diagnosing Chagas cardiomyopathy involves a combination of methods. First, serological tests are used to detect the presence of antibodies against Trypanosoma cruzi in the blood. If these tests are positive, further cardiac evaluations are necessary. An electrocardiogram, or ECG, can detect arrhythmias and other electrical abnormalities. An echocardiogram, or ultrasound of the heart, assesses the size and function of the heart chambers. In some cases, a cardiac MRI may be used to visualize the extent of myocardial damage and fibrosis. A Holter monitor, which is a portable ECG device, may be worn for 24-48 hours to detect intermittent arrhythmias. While there aren't distinct types of Chagas cardiomyopathy in the same way there are types of other cardiomyopathies, the severity and specific manifestations can vary. Some patients primarily experience heart failure, while others are more prone to arrhythmias. The degree of heart enlargement and the extent of fibrosis also contribute to the variability in clinical presentation. The treatment of Chagas cardiomyopathy focuses on managing the symptoms and preventing further heart damage. Antiparasitic drugs, such as benznidazole and nifurtimox, can be used to eliminate the parasite, particularly in the acute phase of the disease. However, their effectiveness in the chronic phase is less clear, and they can have significant side effects. Medications for heart failure, such as ACE inhibitors, beta blockers, and diuretics, are used to improve heart function and reduce symptoms. Antiarrhythmic drugs or implantable cardioverter defibrillators (ICDs) are used to control arrhythmias and prevent sudden cardiac death. In severe cases, heart transplantation may be considered. Prevention of Chagas disease is crucial and involves several strategies. Vector control measures, such as insecticide spraying and improving housing conditions, are essential to reduce the population of triatomine bugs. Screening of blood and organ donors is critical to prevent transmission through transfusions and transplants. Education and awareness campaigns can help people understand the risks and take preventive measures. Pregnant women in endemic areas should be screened to prevent congenital transmission. The prognosis of Chagas cardiomyopathy can vary greatly depending on the severity of the disease and the individual's response to treatment. Early diagnosis and treatment can improve outcomes. However, even with optimal management, the condition can progress, leading to significant disability and reduced life expectancy. Recent research is focused on developing more effective antiparasitic drugs and therapies to reduce myocardial inflammation and fibrosis. Studies are also exploring the potential of regenerative medicine approaches to repair damaged heart tissue. Ongoing research offers hope for improved outcomes for individuals living with Chagas cardiomyopathy.